We've done a number of interviews now with international experts about the airborne aerosol transmission of COVID-19. Their opinion is that the science is settled, that if it's not the primary pathway to infection for the virus, it's a very important one. And that raises the question of, can it travel through ventilation systems within buildings, particularly in hospitals? Well, there's a new study out, and I'm going to talk to one of the co-authors, Professor Joan Grimalt, and he joins us from Barcelona, Spain. Welcome to the interview, Dr. Grimalt.
Hello, I'm happy to be here to talk to you.
Well, thank you for doing this. Now, your paper, if I understand it correctly, took samples from rooms and corridors in hospitals and found that the incidence of the intensity of the virus in those samples was fairly high. Have I got that correct?
Yes. In some areas of the hospital, not all over, but in some areas.
And which areas would those be?
Well, first, the rooms where there were ill people suffering for COVID, as expected. But secondly, in the corridor attached to the rooms, there were even higher concentrations of the COVID than in the rooms themselves.
Now, and it's your conclusion that this that the virus got into the corridors through the ventilation system?
Well, not exactly. Perhaps it went in and out also because when they were opening the doors, there wasn't a change of air. The point is that in the corridors, there was much less ventilation than in the rooms. And this is perhaps what helped in the accumulation of COVID in the corridors.
So you're not quite clear whether or not there was, whether the virus traveled through the ventilation, the HVAC system, as we call it, but there was less ventilation of that. Less air was moving in the corridors, and that led to the higher concentration.
Yes. This is is very common in many hospitals, at least in Spain, because this was a new hospital, not an old one. But normally, the highest ventilation rates are calculated to have them in the rooms with the patients. So in the corridors, there is less. And what was interesting is that physicians took a lot of precautions to go into the rooms with the patients. They were dressed in a very with a very adequate way. However, in the corridors, they were dressed more informally. So there was higher risk of nosocomial infection in the corridors than in the rooms themselves.
And I think we should distinguish between a hospital room where a COVID patient might be convalescing as opposed to an ICU where they might be intubated and where you found very little evidence of the virus in the air.
Yes, because since they were intubated, then all the air from the patients was eliminated, it had no chance to go into the corridors, and in those corridors nearby the ICU units, the ICU was very low. The COVID concentration was very low.
Is it the case in Spain that healthcare workers are in the hospital are required to wear masks? And if so, what kind of masks? Like a surgical mask or an N95 mask, that sort of thing.
Well, yeah, they are, yes. But let's say all the precautions are taken when they go to treat with the patients themselves. When they are in the corridors or in auxiliary rooms, these precautions are not so strict. And in those, sometimes they were not wearing masks. I must say that because of this study, they took increasing precautions, and later the amount of SARS-CoV-2 decreased in the corridors. But I know that in other hospitals they have had problems of nosocomial infections that a priori they could not explain.
Oh, I see. Okay, so is it fair to say then that the conclusion from your study would be better ventilation in the corridors, as well as extra precautions by healthcare workers to be masked in areas where maybe they weren't before?
Yeah, I think this is very important because, and also, yeah, it's very important because, is the way to prevent or to decrease nosocomial infections, not only with the sanitary people, but also with other ill people who is not in the hospital because of COVID, but they were also cases of infection in some hospitals that they could not explain a priori. I know hospitals in which at last they decided to put all the COVID patients in one building, separate from the rest of the people, the patients in non-COVID patients in another building, because that way was the best to avoid any nosocomial infection. But I think that there is a problem, or might be a problem, in many places because of this transmission of the SARS-CoV-2 through the air, which is a secondary way of transmission besides, let's say, person to person.
What is your opinion about the need for individual hospitals to do studies, maybe engineering studies, of how air flows in their hospitals so they can determine where concentrations of the virus might be high in places like corridors? Should they do those studies?
I think so. I think so, because in the past, perhaps the way these hospitals were designed was sufficient, but now in the context of this new virus, which is able to be through the air, it has a strong transmission potential, and also, well, if we are going to very small particles, these small particles, they maybe have nearly as gases. I mean, there is the Brownian movement, and this, if the virus is, if it is not agglomerated, it moves through the Brownian movement, and this means that in practical terms it may behave as a gas. So obviously the virus has a time that it can be infective. I mean, after some period of time, it is no longer infective. That's correct. But it is clear that hospitals now should reevaluate the ventilation system. And also it would be very good that themselves, they do some controls of the amount of SARS-CoV-2 in the air to be sure that they do not have cases like the one we discovered.
Final question, Dr. Grimalt. Was the concentration of the virus in your samples intense enough to infect someone who might come in contact with that air?
Well, this is difficult to say because we analyzed the genes. However, what we didn't do was a culture of the virus itself. So we cannot state that these genes, the amount of these genes was infective, because to state this, we had to do a culture of the virus And this is, let's say, very complex, and it was not possible. However, what is clear is that a priori there should be no virus at all in the air. And let's say we have analyzed the air in the street or in elsewhere, using the same system, and elsewhere there was no virus at all. I mean, there were no genes at all. So it means that the risk was there. However, we cannot state that because of the amounts we found, it will be infection. And sorry, and all, but we know, we know for other hospitals that they have had a lot of trouble because of nosocomial infections, despite there were very strict regulations, such as that nobody could visit the patients suffering from under treatment by SARS-CoV-2. Despite there were very strict regulations concerning these people, at last they were infections which a priori could not be explained. Even in different floors, they appeared infected people that it was difficult to handle. Why is this happening?
Well, Dr. Grimalt, thank you very much. I really appreciate your insights on this. Thank you for joining us tonight.
Thank you. Thanks for very nice to talk to you.